Tuesday, January 19th, 2021, 6:32 p.m. I'll call the Board of Selectmen meeting to order. Couple announcements. This meeting is being recorded. Minutes are being taken by Gail Hunter. One community announcement. We had the Congregational Church bells ringing today at 5:30, and this was part of an event that happened across the country. There are communities all across the country that were ringing their bells to honor the people who have passed away from COVID over the past year. So our community was participating in that as well. Let's see. Before we get into the agenda, a quick discussion about tonight's meeting and what's on the agenda. The heaviest part of the discussion, or rather the longest part of the discussion that I anticipate happening, is going to be during agenda item number 5, which is the FY22 budget discussions, or with the topic of dispatch. So bearing that in mind, I'm planning on not getting too terribly bogged down in items 3 and 4, which are the email policy and the review tree and the tree policy items. I'll try to keep those relatively tight. The COVID update as well. All right, so before we get started, ordinarily agenda item number 0, if anybody has any comment for any items that are not on the agenda, if you would like to speak, just let me know and I'll let you address the meeting.
If nobody else does, Eli, I do.
All right, give everybody else a minute to go and then I'll let you go.
Thank you.
All right, I see no hands raised, so go ahead.
Okay, and this is just in response to a lot of outreach that I've had to me. And I think given the level of the interest in the potential 40B and 40R, I've had many townspeople reach out to me about land use and the master plan. A number of these people felt that they had had no input or opportunity for input in the master plan, and that perhaps the master plan was the contrivance of the town administrator and the town planner. I've had to reassure them that the master plan was required by the state and developed over 5 years with as much citizen input as could be obtained. The ideas in the master plan were driven by citizen input. While there are a lot of boards and committee members who work hard on behalf of the town, there's no one, in my opinion, who works harder than Greg. Based on my years of working with Greg Fetterspiel and Sue Brown, my experience has been that they are both honest and earnest. I feel that our town is so fortunate to have them looking out for our interests. And I just say, if anybody has questions, they should perhaps acquaint themselves what Greg's and Sue's jobs descriptions are. And I think they'll find that what they do for us is far in excess of that, and done on behalf of the town and the town's best interests. Thank you.
Thank you, Becky. It's oftentimes we don't we don't spend enough time recognizing our town employees and the work that they do for us. And I think it is important to let them know that they're appreciated for the efforts they put in for the town. All right, we'll move on to agenda item number 1. This is a committee interview for Sean Zahn for the Zoning Board of Appeals under the alternate seat. We're going to hear from Mr. Zahn tonight. Have a chance for the board members to ask a few questions, and we'll make our decision at our next meeting. Mr. Zahn, if you would be so kind as to unmute yourself, introduce yourself, and give us a little bit of an introduction to yourself, we'd appreciate it.
Hi, thank you for having me tonight. My name is Sean Zahn. I live here in town. Lived here for about 12 years now. I've used to own a house up on 85 Summer Street, and we just sold that in October. And I live in a loading place now. I'm currently, I just retired in October, and after 29 years of service with Delta Airlines, and now I'm looking to be as more involved in community as I can. And that's it.
All right. Board members, questions?
I do, if nobody else is ready.
Yep, go ahead, Becky.
Hi, Sean. I always like to say thank you very much for putting your hand up. It's always remarkable how many people in this town volunteer their time and get a lot out of it. My question is, you have recently retired, so I'm presuming that you will have no issues with availability.
That is correct.
And have you, by any chance, had an opportunity to look over any of the town bylaws, zoning bylaws?
I've just started to actually glance through them. I'll put it at the best. So,
Well, it's easy. Once you get in the position, then it's much easier to understand how they come into play. But one of the issues, ZBA has, as you can imagine, some pretty tough decisions to make sometimes. And sometimes they can include decisions regarding your neighbors.
correct.
And while we all hope nothing is done personally or taken personally, would that be any problem for you?
No, not at all. As long as, I mean, we've got the rules to follow, so that's.
Exactly. All right. Well, thank you again very much.
Thank you.
I have a question, Eli.
Go ahead, John.
Okay, Sean, and I wanted to echo Becky's comments that certainly we're very grateful that you're volunteering your time. And the zoning board, no question, is going to take, I think, a good deal of time in the coming year. It's going to have a pretty full agenda, I think, based upon what's been going on and what we expect to have happen. A couple of things. I was just wondering, in your other positions, have you dealt with conflict? And because I think this is probably one of the more contentious types of, I won't use the word contentious, but there are more disagreements probably in zoning board hearings than in many of the other committees that are out there. And I was just wondering if you had dealt with that in your 29 years at Delta. That's a long time.
Well, I did. As I worked for Delta, I was safety environmental coordinator for the Northeast.
Yeah.
For 11 years, I did that. So I worked with a lot of different agencies from federal and local. So dealing with different groups, different personalities, you learn. I've had the experience of trying to do all that. So yeah, dealing with conflicts is not something I'm not new to. So.
Okay. All right. Well, that's good. You'll need that experience probably. Good. Well, thank you very much. Well, one other question. You looked at the zoning board, and there are a number of positions and other openings, perhaps some of the other committees and boards here. Was there something that drew you to the zoning board in particular?
No, nothing particular. I mean, just the idea just kind of intrigues me, and I think I think it's a good spot for me to start getting my feet wet within the town, as far as getting in. Due to my job and everything, I just couldn't be involved with too much as far as getting into the town stuff. So it's this as of last July, I'm the current president of Manchester Essex Rotary. So that's up in July. So that has actually taken a lot of my time this last year. Now that I'm retired, I definitely have the free time. So
Zoning is one of the more busier and active boards in town here. For
yes,
sure.
yes.
So, yes.
So
Thank you.
I like to be busy.
If I may,
Yes, please.
you are probably aware that the town is facing a 40B application, and that the ZBA is the board which is mostly involved in setting the boundaries or attempting to set the boundaries on that project. Do you know anything about 40B?
Not enough to say that I'm well versed on it now.
How familiar are you with how quick a study are you of things like the Massachusetts environmental protection regulations?
Well, a lot of that I had some experience with prior, so that would be very quickly to catch up on for current.
Excuse me, I didn't thank you for volunteering. Thank you for volunteering. This is not going to be an easy position.
No,
It will start suddenly and will require a lot of expertise from that board. And I want to be sure that you are prepared to put in not just the committee time, but the background learning time that's going to be involved.
oh, absolutely.
Thank you.
Jeff?
Sean, I just want to thank you for stepping forward. I echo the other board members here in trying to be really clear with you that this is probably one of the most challenging committees to be on in the next year. It's challenging most of the time, but this is particularly a challenging year because of the 40B. So any support that we can give you in terms of getting up to speed on these things, in addition to what you'll get from the CPA itself, we'd be happy to do.
I really appreciate that.
Sean, a couple questions for you. So in your travels and your various different activities, different organizations you've dealt with, have you ever been before a zoning board or a planning board, or been involved in a public hearing that had some judiciary role? So somewhere where there was a decision that was being made that was binding on others, anything along those lines?
I have sat on a couple past, not here locally. And others, and I lived in Texas for a number of years prior to here. So I sat on a couple zoning boards, just on their meetings and stuff. So yeah, I've witnessed some of the stuff that has gone on. I've read some of the stuff that's come out from the posts and stuff. So to see what decisions and stuff were being made.
So in the meetings that you sat in on, were you sitting in on those because you were an interested party, or you were participating in the meeting so for example, as an abutter making a statement? Were you participating in the proceedings in any way? And to what extent did you have to familiarize yourself with the aspects of the legal proceedings that were, relatively rigid and formal in their process?
It was just purely as an observer to see what was going on. with some of the zoning changes that were happening down there.
Okay, when was that?
That was back in 90, was it 90, 2000, excuse me.
Okay.
2001.
All right, any
It's been a
other,
while.
what's that?
It's been a while for that. Other than just reading the stuff going through the town here.
Okay. Any other questions or comments from board members?
I do have another, Eli, if I may.
Yeah, go ahead, Becky.
I think this was sort of briefly touched on, but the motivation for getting on the zoning board, I typically like to ask people if there's any specific agenda or reason that they feel compelled to get on a board like this.
My whole thing is I want to give back to the community that I love, and I want to see us to get this town to continue to grow, but still keep its small town charm. So
Wonderful.
yeah,
Thank you very much, Sean.
thank you.
What's your understanding of the roles of the alternate seat as opposed to a full seat on the zoning board?
My understanding is it's just it's got to follow everything that's going on, and then the moment that you might be called on to fill in, but you stay up with everything that's happening.
All right. That's all the questions that I have for now. So we will think on this, and then we will make our decision, take a vote at our next meeting. And I
All right,
appreciate
thank you for your time.
coming to us tonight, and thank you for volunteering.
Thank you, Sean. Good night.
Thank you, Sean.
Thank you.
All right, let's move on to agenda item number 2, COVID-19 update. Greg, do you want to summarize?
So, conditions in town, I would say, are a little more stable. We're not seeing quite the number of new cases. We've calmed down a little bit from the holiday, both Thanksgiving and Christmas holidays, in terms of a bit of a spike in numbers. So it seems that things are calming down a little bit. Still a lot of concern out there, of course. Statewide, cases continue to come in at a pretty high clip. We are one of the higher infectious states in the country right now. Concerns about the more contagious version of COVID making its way here. We'll see. Perhaps it does more here than we realize already, but there's at least one confirmed case in the state. And at the same time, we continue to be hopeful that the vaccine will be more available for everybody. The state is rolling out a methodical approach to vaccinating folks, starting with health workers, healthcare workers, and then on to first responders, and then moving to folks who live in congregate living, nursing home situations. That's the group being focused on now, as well as prisons, et cetera. General population anticipated, sometime in April for those under 65. So there'll be a push to get those 65 and older in February here. So the monitoring and tracing continued to be a lot of work, but so far, just below the chaotic level. Mary Higgins doing a very good job for us as public nurse, certainly working a lot more hours and harder than what we had anticipated, but nonetheless, appreciate her time and effort with all of that. So attention is turning towards vaccinations and how we might participate and facilitate the vaccination process in town, whether or not we want to team up with either other towns or the private sector. The state will be opening up in each county what they're calling a mega clinic, at least one in each county. And the state will be announcing the details of that for Essex County, hopefully soon. It'll be, I think it's going to be in Danvers for Essex County, so not too far away for us. There's also an effort, a multi-town effort to set up a clinic for residents of multiple towns at the Topsfield Fairgrounds. In addition, the pharmacies are gearing up. Walgreens and CVS are already providing vaccinations, and locally, Allen's is hoping to team up with Conley Pharmacy, or drugstore in Ipswich, and the two of them are looking to provide vaccinations in town when the time becomes appropriate for that. There'll be a meeting tomorrow of a working group. Dr. Hahn is attending, as well as Joan from the Board of Health, as well as Mary Higgins, our public nurse, and a few others, to help us think through how we might best facilitate a clinic in town, whether it be something we set up on our own with similar to how we've done our flu clinics in the past. This is more complicated given the shelf life of the vaccine. You have to use it within a certain amount of time, and its storage and handling is much more delicate than the flu shots. So we'll be talking about that starting tomorrow, and hope to advance how best to do that in the next couple of weeks with a game plan going forward, which we would hope to present to you at your next meeting at the latest on February 1st. So that's a quick lay of the land. I know Dr. Hahn is with us tonight to represent the board, and he may have some additional comments as well.
Martin, do you have any comments to update on what Greg just said?
Yeah, this is Martin Hahn. Thank you for discussing this and letting me chime in. It's a little early for us to give details on planned clinics. We just received a draft plan from Gloucester today that outlines their plans with regard to establishing a clinic vaccination opportunity for the citizens. And there's certainly opportunity to partner with them. It looks fairly complex, and I have to second Greg's comments that it might be too complex for a town our size and with our resources to do that on our own. So we will have a meeting tomorrow to go through some of these draft plans and see where we can interface with other communities in the surrounding area and come up with a joint plan that is most feasible and practical for everybody. I don't have much else to say at this point regarding that.
Questions or comments from board members on vaccination?
I do, if I may, Eli.
Sure, go ahead, Becky.
Of course. This is actually for Martin, and hey, Martin.
Hi, Becky.
Is the task force the same as the vaccination subcommittee?
Yes, it is.
Okay, so that meeting's 11:30 to 1 tomorrow?
Correct.
Okay, and how are we doing with our first responders?
I believe the first responders have been vaccinated, and I've heard there was about a 70% participation rate, and this has been done again through Gloucester because we do not have enough first responders to qualify for a separate vaccination entity by the state. So it had to be coordinated through a town that has those resources and has that set up, and that was done through Gloucester.
And so the 70%, as opposed to the 30, have you had any reasons why 30%?
We
Was
do
not-
not. We do not have details. We assume there were some people that just did not want to get vaccinated, but that data is not available to me.
Okay, thank you very much.
You're welcome.
Eli, I have a question.
Sure, go ahead, Jeff.
In follow-up to what Becky just said, Martin, is that 70% of all the participants that were teed up for Gloucester? That would include Gloucester and Manchester? Or is that 70% of our first responders here?
If I understood correctly, it was 70% of our first responder force. That is the number that I heard from the Board of Health. And I don't know how the other towns fared that participated in this, or Gloucester for that matter. But I heard from the eligible people that Manchester had for participation, 70% actually opted to get vaccinated.
Based on your knowledge of the vaccine rollout in other areas of the state and the country, is that 70% number a pretty stable number? I've heard 30%
Yes.
refusal a lot, and I'm just wondering whether that's following the same.
I think in general, we have to assume that kind of percentage in the population is reluctant or adversarial to vaccination for whatever reason, or just wants more time to go by. It also potentially takes into, within those 30%, maybe people that have had it. So we don't know exactly whether all those 30% were people that should have gotten it because they are negative and has not had COVID-19. So, but in general, I would say 30% is a pretty widespread estimate across the country. In terms of rollout here in Massachusetts, Massachusetts had a slow start compared to some other states, but is starting to catch up and getting more efficient in delivery. So I think the numbers will hopefully improve.
Okay. Thank you.
You're welcome.
Other board members?
Yes, I don't know whether this is a question I assume it's a question for Greg. Is there anything we can do to encourage first responders to be vaccinated?
So we have provided quite a bit of background information to all of the first responders. Just information about the vaccines and the efficacy and the safety of them. There's quite a bit of materials that we were able to provide to them, and have encouraged all of them to sign up and to get the vaccination. But as Martin indicated, there some perhaps had already gotten COVID and didn't feel they needed the shot. Others have a reluctance. This includes, the 70% includes our part-time reserves as well. And so some of them may feel like they will be getting the shot through their own full-time employment. For some of them, this is just a part-time position, sort of fill-in work. So they may be focused on their other place of employment.
I understand. However, these people are avoiding a vaccination that could make them less of a danger to their colleagues and the people they serve. And that, if there were a smallpox epidemic, I assume we would be vaccinating regardless.
Well, this is Martin answering to that. There's no duty to get vaccinated as a healthcare provider or first responder, as there is no duty for anyone. There's no mandatory vaccination. While I agree with you that it certainly would be advisable and desirable that everybody who is a first responder and a frontline healthcare worker should get vaccinated, that unfortunately by no means is reality. It is up to the individual. There's no requirement that you have to be vaccinated to continue performing your duties.
Thank you.
I did get an update from fire chief, and then on the fire side and EMTs, it was just over 95% participation
That's good.
on the fire
Okay.
side.
Yeah. I have a question, Eli, for I guess for Greg. How many first responders are there in general here in Manchester? And so how much is 1/3 of that that we're not vaccinated?
Let's see, I've got 24,
We got 30 or 40.
36. You know, you're around the mid 40s.
Okay.
If you count
All
everybody.
right. All right. So there are probably 15 that opted out. We don't know the reasons, and I understand that they don't have to give reasons. Although some may have been exposed to COVID or something, had an antibody test, and they know that they're resistant at this point. But we don't. Do we have any answers from any of them that were volunteered? We just know they've declined.
Correct.
Eli, can I speak for a minute?
Yeah, go ahead, Todd.
Just the survey that I put out in the police department, I had about 72% initially say that they were going to respond and take the vaccine, which they did. I had 3 officers who were diagnosed with, or 3 staff members that were diagnosed with COVID and tested positive, and they were advised, some of them were advised by their doctors not to take the vaccine until 90 days after their initial positive test. With that, I know of a couple other staff members since we started the vaccination process, and since I put out the initial survey, have taken the vaccine. So I'm thinking our numbers are going to be a little bit higher than the 70%.
Okay. Thank you.
Thank you, Todd.
All right. I don't have any. I think the vaccination topic's been covered fairly well from my perspective. So I was going to move to a different topic under COVID, if that's all right with board members. All right. I want to talk a little bit about communications. And Martin, this is going to sound a little bit like beating a dead horse, but so I've raised this issue myself before the Board of Health, but it's not been the case that anybody from the Board of Health has had an opportunity to hear this directly from our board. And we did have some discussions about it at our last meeting, and that's topic of communications. So I know that the state gives fairly specific guidance about releasing COVID numbers on a weekly basis. And I understand that, and I understand the need for protecting privacy, so that just in general, you can protect privacy, and just so that contact tracing can be done, and that we keep that bond of trust between the Board of Health and the residents. But I still feel like we are under communicating, and I'll give you some examples where I think we could be doing better, and where I continuously hear this message that represents confusion from the residents, where I think that we could do a better job of clarifying the state of the the town with respect to COVID without coming anywhere close to infringing on privacy. First example is we release our numbers on a weekly basis. We see our current cases, current active cases, and the current total cases. And those are the two numbers that we release, period. And when we release those, the history of the previous numbers goes away because we don't keep those. We don't maintain those in a clear available record on the website. So people constantly are asking the question, well, what's the 2-week total? Because the 2-week total is actually relevant to how the state views the town with respect to its status with respect to COVID because of their population. And that information is not rolled up and presented in any way. So people have to either remember to track the previous number, and then they get confused about how the calculation is actually done. So we're adhering to the state's absolute minimum requirement, but in the process, we're presenting this sort of tantalizing number, which is confusing and not particularly helpful, I don't think, to residents because it just raises questions. So that's one example. And the one question that gets re-raised consistently is, and I see it answered on social media periodically, is, well, if we had this many cumulative cases last week and now we have 14 more, but we only have 2 more active cases, what happened? How does that make sense? And we don't actually provide any information explaining that between any of our communications. And I think we're doing a disservice to our residents because we're being so parsimonious with the information that we're putting out there. The residents are just confused by it. And I know the state has provided this extremely minimum little guidance for what we should be putting out there, but I really feel like we could be doing a little bit better without jeopardizing privacy or jeopardizing the bond of trust between the Board of Health and the residents that we serve. So I wonder if you could respond to that. I know that, yeah, anyway.
Sure. This is Martin again. Yes, certainly we can carry over previous weeks, 1 extra week, 2 weeks back, 3 weeks back, 4 weeks back, doesn't matter really how long, onto the town website to basically give the population a better overview of trends as they're developing. But you know, we do kind of report cumulative cases plus active cases as far as I know. But you know, there's really no harm in breaking it up into the previous weeks. I can certainly discuss that with Alan and have them change that on the website, that the previous week or 2 are displayed so people can see the trend. With regard to breaking down what kind of cases are present, meaning active versus asymptomatic versus hospitalized and so on and so forth, that gets a little tricky because, number one, the public health nurse gets into contact with the patients as they're being diagnosed through the DPH reporting. And when they talk to each other, they will find out whether the patient is symptomatic or not. But that evolves over time, and it is not that the public health nurse is constantly in contact with them. The public health nurse is tracing contacts, doing all kinds of things. The town is not following those patients, those cases, with regard to their medical course. And I don't think that's the job of the public health nurse, and I don't think we have any way of actually tracking that. So that information will always be incomplete in terms of active cases, asymptomatic cases, and things like that. I don't think that can be improved upon. And I've not seen that in other towns with that level of detail.
Well, you know, what would be great is if we could provide a brief explanation of exactly that, why we can't provide that level of information and why it wouldn't be particularly helpful. Because then people don't create a vacuum into which they'll fill a vacuum with their own opinions and thoughts, and it can be not so helpful.
Where would you like that to be explained, on the website, or?
I
I'm
would
not
think so.
sure, generally people, I have not heard people ask us or me personally whether there's, a lot of sick people or not sick people or asymptomatic people in town. I've not encountered that, but that may be because I don't get those calls, but you may have had that question posed to you. I'm not sure.
I got a mix of questions, but I think the ones that are most common are around the differences between active cases versus cumulative cases and why the numbers shift around. So, for example, an explanation that's commonly given by the public health people is oftentimes what will happen is people will be tested, but they won't be tested until like 2 weeks into their personal situation or their illness, from the progress of their illness. And as a consequence, they'll come off the rolls of active cases much, much faster than other cases might. Some simple explanations of why those numbers vary due to that, I think would help. And that information is just not up on the website, but it has to be repeated to people on a pretty regular basis.
But how would you, I'm still not clear where that should be posted. Should there be like a medical page on the website explaining the difference between, an asymptomatic case or a positive PCR versus a positive antigen test versus how long somebody stays positive with the PCR? That information is generally pretty readily available on the internet, but would you want something like that on the town website, like a COVID fact sheet or something like that? I'm not sure I know what you're looking for yet.
Well, I think I'm looking for something that's a little bit more relevant to the residents and the simple report that we make, the numbers. Why do the numbers work the way they do in the reports that we put out, the limited reports that we put out?
Well, the thing is that the only thing we really can report based on what the public health nurse gets is active cases, meaning recently diagnosed and being actively tracked, and contact tracing being done on those, versus cases that are assumed to be resolved based on the duration. So again, that will fluctuate from patient to patient.
Yeah. Well, so how about this? If we were to put together a list of some of the questions that we individually receive that are generic in that nature, that wouldn't get into the business of violating privacy, could you guys take those up and consider how to create a fact to put on the website? And
Sure.
maybe work with Tiffany to.
Sure. Yeah, we can certainly do that when we have more concrete questions regarding that, because I think what you're asking is difficult, because the Board of Health and the public health nurse really get very, very limited information. They get a name, an address, a date of a test, and a positive. That's pretty much it. And then the nurse calls those people, figures out the contact tracing, asks them about symptoms, makes sure they have medical follow-up. That's pretty much it. That's the purview of the public health nurse in terms of figuring out the implications for the community. in terms of identifying contacts, tracing them, making sure that person is plugged in medically. Above and beyond that, there is no apparatus to really track these patients. But yeah, I'm happy to look at the compilation of questions that you encounter and see whether there's some general statements that we can make on the website as a fact sheet that would explain those to the townspeople.
Eli, I have a question or a comment.
Yeah, go ahead, John.
Yeah, so yes, Martin, I think what you just described it would be helpful to people. I think they need to know a little bit about your methodology so that they know what you know, and perhaps just as importantly, what you're not going to know from these patients. And what I understand is you're not contacting these patients on a weekly basis to say, where do you stand now?
Oh God, no!
You've got your
That's
information.
neither legal nor
Right.
we are not the treating entity. You know, we
Right.
have no business
Well,
involving us that.
the number we're trying to get at is prevalence versus incidence here on any given weekly date. And you had 14 active last week and 14 active this week. And that doesn't tell us anything about, what was the incidence this week versus how many are carried over from last week. And you have to make some assumptions about if somebody's positive 2 or 3 weeks ago, well, it's 3 weeks later, now they fall off the list. Is that kind of how it works? And then,
Yes.
yeah, okay. Well, I think that would help people a lot. If you tell them that, then they know that's what's going on. And, a breakdown of this is how many fell off the list last week and next week.
The problem is the weekly report doesn't really reflect reality either, right? So a case that gets diagnosed end of last week is still going to be active the following week. And a week that was diagnosed at the beginning of the week may become inactive the following week. So it's very difficult for the public health nurse, without tracking those people over time, to decide what is active and what is inactive. And they don't have neither the means nor the medical mission to do that. That is not the job of a public health nurse, to follow those patients. That's really the medical provider's job and obligation. And as much as that would be lovely to do as a public health nurse, they would have to maintain medical records, which is a problem in itself, to track all that information and maintain HIPAA requirements on those. It gets very sticky very quickly. So I see what you're saying, and the transparency can certainly be improved by maybe breaking down the data from week to week a little bit more. But above and beyond that, I'm skeptical that we're going to get into too much detail.
No. I don't think anybody's asking you to try and get more information, et cetera, but whatever assumptions are, and you do make assumptions, after a certain period of time, you're assuming that person is not active anymore. Whether they are or not, you don't know, but you've assigned some sort of a number to that.
Correct.
Number of weeks, and that would be helpful.
Okay.
I wonder if I could just try and simplify this a little bit. A simplification of new active cases and I don't know, continuing, or just active cases, 13, 6 new.
I think we do report the number of new.
No, not that I've seen. All I've seen is active cases and total cases.
All right, I've seen that where they say newly diagnosed.
Well, then maybe I'm not looking closely enough, or maybe I'm looking at different data than you are. But what gets posted on the website that I've seen has been active cases and total.
I will discuss this with Ellen and Mary and see where we can, and obviously then with Tiffany as well, with regard to posting.
Okay, I appreciate that, Martin. And
absolutely.
We're not trying to just drag you into a
no, of course,
needle in a haystack kind of thing.
Uh-oh.
Not a problem. And then, yeah, Eli, if you could send me a compilation of questions that you guys have come across, and we're happy to create some kind of a fact sheet that can get posted to alleviate some of those questions.
Absolutely. All right. Well, there's no other questions from board members on this topic. I'm going to move on. Martin, I appreciate you coming tonight.
Very welcome.
It was nice to be able to have this chat. Okay, let's move on to agenda item number 3. We're not too terribly far behind. Yes, we are. Town email accounts policy discussion. Last meeting we had a discussion about this. This discussion started around the notion of having all committee members, or whether or not we could have all committee members have town email addresses and some of the ramifications. And one of the questions that came back was around cost. Was there a cheaper cost model? And we did get an answer on that. There is a cheaper cost version. It's about half the cost that was reported to us last week. That's still fairly significant. $9,600 a year as opposed to $18,000, $19,000, $20,000 a year. We still have the issues of managing the various different accounts for each board or committee, given board turnover. And one question's been raised is whether or not we simply create a chair email account for each of the appointed committees and leave it at that. So anyway, a brief discussion from board members about where they think they are on this, where they might want to go. I don't anticipate making a final decision on this tonight. I just want to get some additional guidance in case we need to go back to Greg with more questions, and in case we need to ask Finance Committee what their opinion is. I'll open it up to board members.
Eli, if I could start out here. I took a moment and put together a quick spreadsheet of the committees that we have. This is part of the work that I've been doing on missions, and listed the attached staff, the chairs, the total number of members in the committee, and whether in fact they have town email at this point in time. Of the all the committees across the board, only the selectmen and the planning board have town emails. There is one personal email that's posted on the website, and that's for Harbor Advisory Chair Carl Doan. And I'd like to see that changed if we could. But the total number of members of all the committees that are listed on the website is 189, and there are already 12 members, 7 planning board members and 5 Board of Selectmen members that have town email. So we're talking about 177 accounts. And I've seen numbers thrown around as 200 to 300, and that surprised me because I didn't think that we had that many people. I may be off in terms of my counts. I used the data that was on the website. But that's the information that I have about accounts. And I think that some committees may need to have town emails in addition to the chair. We've talked about that before, about Concom, FinCom, maybe ZBA, that those would maybe have town emails. But otherwise a chair would have the town email, and the individual members would not.
Eli,
Yeah, go ahead.
I sent that, by the way, I sent that spreadsheet out right before our meeting to everybody.
okay, I have not seen that yet, Jeff, but I'll catch up on it. My initial reaction is that chairs should have emails. I don't think other folks need it at this point. I think it's something we can see how that might work for a while. but 170 something people with emails, and you've got computer skills all over the map, the tech support is going to be a challenge. You're going to have people calling for all kinds of assistance, and I don't know what goes on with these emails. I assume that probably the annual cost includes some sort of tech support from Sandra Networks, but I think that it's going to be tough to try and manage that with so many folks, and maybe just the chairs are good enough. I mean, we've survived with none at this point, and I know that there's been a lot of personal email use as a result, but the chairs make sense to me, and then see how things work from there.
Other board members?
Oh, and excuse me, by the way, Jeff, so how many committees or boards do we have? That 177.
Thanks, John.
Put you on the spot.
I'm fast. Eli, I do have a comment, if I may.
Sure, we'll just let Jeff interrupt when he gets the number.
Yes.
Okay, when he gets those.
I count 31. Sorry, Becky.
No. I like the idea of chairs having emails, but I think that the committees that really should have email addresses, I think would be, in addition to Board of Selectmen, would be the Planning Board and the ZBA.
The FinCom.
Well, I think FinCom less so myself, but the chair, if you get a hold of the chair of FinCom, I don't, anyway, that's just my biggest concern goes back to open meeting law. I think OML, I think if we could do refresher courses or have something online where we have everybody new to a committee or board, as well as the refreshers, which I know some do, but if we all have some way of ensuring that we are up to date on OML, it's a big concern.
And did you have any
So
comment?
I think that having town email accounts would be a reminder to people that what they're doing is not the ordinary email where you just blast something out to everybody you can think of who might care. And if you're using your own email, remembering that that's not something you're allowed to do is a little harder than if you have to go to someplace special and use a special email to discuss, to communicate with your chairman or whoever in the town employees whose information you need.
So my perspective, I'm trying to balance I think the 177 different accounts, 189, 190, whatever it is. That's a lot of accounts, and managing that many accounts would be, I think there'd be possibly a support burden that would be pretty substantial. And a burden on town resources as well. So I also am thinking about the quasi-judicial committees like the ZBA and others, where members probably receive information. I mean, ordinarily with back in the days when email wasn't around, you would go to your meeting, or you go to the town, and ahead of your meeting, you'd pick up a packet full of information with the public hearings that you'd have to do. deal with. And that was how you dealt with your materials. You picked them up physically. With email, and certainly this year with COVID, much more of those packets are going out by email. And I'm interested in looking at that process for the judicial committees to see what town council view is about those, how other towns are handling that in the modern age. I could see my way towards just the committees that hold public hearings having town emails and not all of the advisory committees. But I'm undecided. So I want to learn a little bit more about that. And unless anybody is opposed, that's all I'd like to say tonight. I think I want to go find out more information about that aspect of it. If other people have other things, other aspects that they want to discover more about, go ahead and say so now. And then we'll come back and revisit this topic a little bit later before I make a final decision.
Eli, I want to just add one small point, which is I don't know what the status of the master plan committee is, whether that's a standing committee or how that's going to operate in the future. But 9 of those addresses are assigned to the master plan committee. So 9 of those members, I mean, are assigned to the master plan committee. And there are other committees here that are less than active in terms of the number of meetings they have in a year or when they have meetings.
Okay.
So just two quick comments or 3. So master plan committee is no longer active. That's not an engaged committee at this time. There's also library trustees. They have email accounts through the library association that they belong to. Say they already have emails. And then in terms of training, one of the victims of COVID has been an inability for us to do the trainings that we had hoped to be doing on an annual basis. It's one of the things that Tiffany was going to be helping with, but she has been co-opted by a lot of COVID communication efforts since COVID hit. But it is something that we are hoping to be able to do, is offer those trainings on a regular basis so that people are reminded and taught about the proper protocols for handling emails and in the open meeting law.
Greg, is a separate issue, I think, but I tried to find the library trustees referred to on our website, and other than agendas for when they met, there was no reference, there was no page, there was no sets of minutes of their proceedings on the website that I could find. And I dug.
Yeah, okay. I think what we are missing is the link to their own webpage.
That
So
would
we'll
be
have to-
helpful.
Yeah, make sure I'll talk to Tiffany.
Because I knew that the library trustees had email accounts, town email accounts, but I couldn't identify who those people were except through a couple of other committees that referenced who they were.
Yeah, we'll get that corrected. Thank you.
Okay.
All right, let's move on to the proposed tree policy. So this item has been bouncing around for quite a while. We've had 2 readings at least on the policy and made a number of different updates to it. And in the last round, it went off to the Finance Committee, and the Finance Committee has kicked this policy around for a couple of meetings now. Trying to discuss the possible financial impact to the town. So the current policy, we've gone back and forth over the years with respect to what defines a town tree. And there was a time when the boundary was something like 10 feet off of the right of way. Um, and then not that long ago, that number was changed so that it was actually interpreted more like 5 feet off of the right of way. And this policy changes it back to something a little bit more in line with the original interpretation. In any case, Finance Committee decided that they really didn't have enough information to build a reasonable financial impact model for the town. And so they are essentially at this point punting it back to the Board of Selectmen, saying we don't take a position on it, and it's up to us to decide where we want to go with this policy at this point. So tonight, what I'd like to decide is just whether or not we're going to approve this policy. Board members.
Eli,
Go
if
ahead,
I
Jeff.
may.
Yeah.
I personally think that it's really important for us to have a tree policy in our town, for all the reasons that were stated in the proposed tree policy. One of my concerns, or I guess question, would be under 3 jurisdiction B, where it talks about the duties of the tree warden. There are a lot of duties, and in the past there was a stipend for the tree warden. Are we considering reinstating a stipend for tree warden? That's one question. And also under 3B, number 6, it talks about, wait a minute, that wasn't it. Anyway, it was just a question regarding, and I did ask this before, but I think, is it just on public streets or both public and private, where it takes, when it comes into no, it was 3B6, monitoring and approving plans for utility vegetation management within the town. Is that on both public and private streets? So is it all the streets throughout town or just public? And I don't think there's any debating that taking care of our trees brings value on a number of levels to our town. Oh, one more. When do we anticipate having an inventory, and who and where will the inventory be maintained?
So Greg, there were essentially 2 questions in there. One was about whether or not it would cover public roads, and the other was about the tree inventory.
And about the
Great.
compensation for the tree warden.
So on the stipend question, we do plan to be going forward with a stipend for the tree warden. That
Okay.
will be coming out of the professional services line from the DPW. Private versus public. So if you're talking just roads, it's only public roads. In terms of utility and the utilities and managing their right-of-ways, vegetation management, that's regardless of where those right-of-ways lie.
Great. Okay. Thank you.
So that's not a tree by tree basis. That's more what's their overall plan and an ability to review that plan.
Okay. Thank you.
And in terms of the new inventory, DPW has not made plans to do a new inventory. It's something that maybe I would see if Friends of Trees and if Sue wanted to comment on that, Sue Minnemeyer wanted to comment on that, I'd welcome that comment.
Thank
Thank you, Greg.
Okay to come in, Eli?
Sure, you can make a comment.
Thank you. We don't, so we have a tree inventory through the DPW as of 2018, and then Trends of Trees records date back to 2000. We would be happy to discuss coming up with an inventory for the future.
Thank you, Sue.
Other board
May I?
members? Yeah, go ahead.
Would the tree inventory include historic trees?
Yes, I believe it would, yes.
How do you find them?
Well, heritage trees, I guess is the word I was thinking of, is defined. There's actually a defined term in state law in terms of based on size. So you try to find as many of these heritage trees as you can. There's no guarantee you're going to find all of them, but I think by putting the word out and letting people know you're trying to do an inventory of that, I think you probably get some pretty good cooperation.
Other board members?
Yeah, Eli, I guess I've got a question that relates to this. I was just looking at the budget here, and it's been all over the place the past couple of years, Greg. I mean, it was budgeted 55,000, came in at half that, and then I budgeted at that, and it came up higher. And I assume this is just due to unpredictability.
So the amount of money we actually spend each year has varied significantly. Yes. A lot of that's based on the storm damage, so in a year that we have a lot of storm damage, that number goes up significantly. So that's the biggest variable is what kind of a year we're having in terms of storms and trees coming down.
But additionally, we received considerable amount of, feedback from residents that we had a number of tree hearings where trees over the years were not really maintained very well, and possibly they would have fared better if we had done a better job of maintaining and pruning them. And that was one of the drivers of increasing the budget a couple of years ago to add to the maintenance budget so that we would do some more of that tree maintenance that would possibly prevent trees from having to be taken down.
Yes, that's correct.
Which requires a tree maintenance plan.
Yes, it does. All right, as far as this policy is concerned, are we ready to approve this policy tonight?
I have one important question, which is that this is dated January 14th, 2021. And my concern is, have there been changes in the language of this since previous versions that we've seen?
Greg?
There were a few edits from the version that you saw in October. I meant to give you that highlight with the changes. For example, instead of 6 months to, let's see if I can find that quickly. Tree replacement number 10 on page 4. We changed at your last meeting that you talked about this October, you talked about giving within 12 months rather than 6 months to do the replacement tree. So that was a change. There was just some syntax that was changed in the definition in 2E under public shade tree. The second sentence just had some wordsmithing. It didn't change the intent or meaning. It just cleaned up just made it a little easier to read the flow of the words. There might have been one other minor one that I'm not remembering off the top of my head, but again, based on your comments at your October meeting. But I can give you that complete list if you'd like it.
I have a question, if I may.
Yeah,
Did we Did we run this by town council? I mean, is this something that was vetted?
Yes, it was. It has been.
I thought so. Thank you.
All right, we ready to go tonight?
Yes,
Yes,
I get a motion to
Yes.
approve the tree policy, the Manchester by the Tree, Manchester by the Sea public town tree policy dated January 14th, 2021 in our packet.
so moved.
Second.
Second,
All right, so that was Becky and Ann. Any discussion? Roll call vote. Mr. Round,
Yes.
Ms. Harrison,
yes,
Ms. Jakes,
Yes,
Mr. Bodmer Turner,
gratefully, yes.
Mr. Bowling votes yes as well. All right, folks, I know that was a lot of work, especially Manchester Friends of the Trees. I know you put a lot of time into it. I think this policy probably is one of the ones that has kicked around more than any other policy we've had in a long time. I think it's been 2 years now, something long. I appreciate the effort that you put into it, and hopefully this will help us do well by our trees. All right. So, moving on. Item number 5 on the agenda. Town budget discussion and dispatch. We're going to be focusing only on the issue of public dispatch tonight, no other aspects of the budget. Greg, we have both the fire chief and the police chief here. Who shall we have presenting first? Or do you want to do a summary here?
Sure. So obviously the question of how best to provide dispatch services has been a topic that has been talked about off and on for quite a number of years, ever since the Middleton Regional Dispatch Center was opened. I think there's been conversations trying to determine if that would be a smart move for the town or not. We currently have a dispatch center that is staffed by some excellent folks. They do a great job for us. So this is in no way a commentary on their work. Quite the contrary, they do a great job with a fairly limited budget and handle our needs very well. So this is a perennial, not a perennial, but a recurring discussion to see if indeed there are ways to provide an even better service at lower cost dollars or not. And we have with us both Chief Fitzgerald and Chief Cleary to help us walk through some of the issues that need to be examined. I know that that regional dispatching can work. It's working in a number of communities throughout the state, but it's always a difficult decision, and one that obviously should not be made lightly, and one that requires kicking the tires all around in all the shapes and forms. So the regional center has evolved since its initial conception. It is now being run by the state. And they are offering the service to communities at no charge. There's no guarantee that will last for the indefinite future. But at the moment, it's an attractive perspective from a pure cost standpoint. Though both chiefs will talk about some of the costs that we would still have, depending on how we would move forward. So I think it makes sense to have each of the chiefs sort of walk through the memo that they prepared for you for tonight's meeting, and then have you ask your questions and see if there are next steps that you want to take. Or if you feel that it's not worth taking those steps. So you don't need to make that decision tonight. I would not expect that, but I think you can get a good overview from the chiefs and perhaps identify additional information that you feel might be helpful in order for you to make a decision here.
All right, shall we, how about Fire Chief Cleary? You want to go first?
Sure, good evening. Let me start off by saying that I really don't have much history with this. So I'm kind of coming in fresh, having only started in July. Know what I read. I know this has been an issue, ongoing issue for many years. The way I approached it and summarized our recommendation for going to the regional center, I look at it as currently what they have to offer and the town has to offer, what allows me and allows the fire department to do the best job we can and provide the best level of service. And that's money aside. They obviously are bigger, more resources, more personnel. My understanding is they have computer-aided dispatch, which would integrate directly into a paging system for us, which would populate our emergency medical reporting forms, as well as our fire reporting forms, page us out, send out dispatches, all from pretty much a single touch of the button. They are also willing to provide all the apparatus with mobile data terminals so that we could get this information directly, which would allow us the ability to have mapping in our vehicles, as well as being able to see streets, hydrant locations, be able to put in pre-planned fire attacks for different buildings we've identified and researched. My understanding too is every time they do an upgrade, they provide that, whether it be software, technology, new mobile radios, new portable radios. So in that level, it's very full service. They have dispatchers that take the 911 call, and that's their sole job. They have other dispatchers that are assigned just to handle the fire dispatching and radios. And they have a separate group of dispatchers that handle the police radios. So they're able to pay greater attention to the individual agencies, and especially in large scale events. Again, to be a single dispatcher and have a major event in town and having to take the phones ringing for 911, monitor the police frequency, monitor the fire frequency, and handle all that is a momentous task. And I give kudos to the dispatchers that have been doing it. I was a dispatcher myself in several different departments, in several different configurations, and it is not an easy job. For the fire department, there's really no cost involved for us. Everything we gain would be a benefit that I would otherwise have to put in my budget. I understand it's different for the police. They're talking about personnel. They're the ones that have the dispatchers and the part-time dispatchers, and that's a totally different animal. But from a fire department point of view, I did not really see any downsides that I'm not already dealing with now with respect to technology glitches or frequencies that can't be monitored, either there or here if we stay in Manchester. So my thought would be I would recommend we go to the regional. However, if we do stay here, I would also recommend that changes be made in upgrading the staffing and the technology for our dispatch to approach the product that the REC or the Regional Communications Center would offer us. That's it in a nutshell. I'm happy to answer any questions.
Chief Cleary, could you also summarize briefly for the meeting? You said that there's limited costs to the fire department or no costs, but there is effort. There are systems that you would have to change. Can you summarize the systems, the technology that you would need to change, and how long you think those system changes would require you to effect?
Well, I do know that all the radio system upgrades that we are going through currently and have already budgeted and already started and are nearing completion with the antennas and the portables and the mobiles, those are readily integratable into the rec systems because they're aware of what we're doing based on conversations I've had. I have fire department reporting software that is no longer supported by the company we have, and to go to a cloud-based system would be extremely expensive, where they would provide the software. So there's some things that we haven't done. I currently don't have a paging software. The paging system we're using to tone out to people via their cell phones is something that Officer Chris Jones designed himself based on his knowledge of technology, which has been serving us well, but it's one-dimensional. It sends us an audio blip of dispatch. It doesn't track anything. It doesn't send out a text page. So I need to buy paging software as well. The system I'm looking at is I Am Responding, and that is something that's the same software that the rec center would also provide us with. Currently don't have any mobile data terminals in any of our vehicles, so we don't have ability for any of the mapping. So that would be another initial purchase that I would have to go through that they would provide. And my understanding is any system we go to for record keeping, to switch over to the rec, they said it'd be about a year of onboarding. That would include going back, archiving the files we have and switching it into the new format. So that would be provided there. Where I buy another software program, we would have to pay for that and wait for it to go, be switched over to the new operating format.
So that onboarding period, is that done after we had already switched over to doing dispatch with the rec, or before even beginning that?
My understanding is once you commit, they have like a 400-step process of information they would need to gain about the town, our records, the police department's records, frequencies, our radio equipment, how we operate, our internal policies. And I believe it was Chris Ryan, who's the assistant director there, said it usually takes an average community 9 months to 12 months to actually get switched over and then begin operating at their center. And it just depends on where we're at and where they're at and what's compatible and what's not.
Okay. Other board members, you got questions for the fire chief, and then we'll hear from the police chief, and then we'll go back and forth a little bit.
I do.
Go ahead, Becky.
Good evening, Chief.
Good evening.
I get one of the questions was during this transition period, how operational is the fire department?
My understanding.
I mean, in terms of the use of the RCC.
Yeah, if I understood them correctly, we would still be operating under the old current system that we have until they're ready to throw the switch and everything gets switched over. I don't know of any particulars if it's done in stages and our records go first and then our radios go and they start dispatching us and they catch up. I haven't seen that document. They usually don't release the 400-step thing until there's greater inquiry or greater interest of the potential for us going there.
So for you to be able to go another roughly 9 to 12 months, do you have to put money currently into how you're operating to be able to function the way you would like to for the next 12 months?
If I knew we were going, I would be able to maintain the status quo and really wouldn't need to make, I wouldn't make those upgrades within the next 9 months if I knew that we were going. I would wait till they were providing that as part of the package. If it were longer than 9 months of a year, then I would probably look into making some of those changes immediately so we would get a greater benefit.
You had said the current planned internal radio infrastructure upgrades that you're working on.
Yes.
I noticed you broke down a lot of the costs, but I wasn't sure where the current planned internal, like again, the radio infrastructure upgrade costs were. Were those in the breakdown on page, your 5th page, last
No,
page?
those weren't included in here because they've already been funded and money's already been designated and those systems are already in place. Radios have already been ordered. So any of the
Okay.
costs you see here would be excluding that. These would be as if that system was already completed. So
Okay,
these would be additional.
thank you. Also, you said that regarding that there have been some complaints with the regional, what is it?
The
Communication center. So those, and what are some of those complaints? And and compared by, I guess, the percentage volume of complaints, what percentage?
I haven't, the only complaints I've heard is that sometimes due to the number of departments that are there, they have standardized their procedures, which may or may not be the way we do everything. Like some departments do vehicle lockouts. So if they get, and some departments don't do vehicle lockouts, but if they get a call, their policy says the department will be sent out. So some of the departments have to alter their policies. Yet in some respects, they have changed their policies to accommodate some of the departments that have gone there. So if we're one off or we have 1 or 2 different ways of doing things, they may be.
Okay, thank you. And I guess my last question, whoops, sorry, I think I froze.
We can still hear you.
Yeah, I can hear you.
Okay, my last question was, you said, you made a comment of, the costs and remaining in the current dispatch. Would any of those costs in remaining with the current system, are any of those applicable under the regional communications center? Or does that not make any sense?
I'm not sure I'm following. If we go to the regional communication center, I would, based on what they've told me, everything that I need to upgrade would be upgraded by them at their cost. So
How
if
can they afford to do that?
if I don't know,
I
but
mean, based on your numbers, that's almost $300,000.
yeah, I don't know.
The state's heavily invested in this. They want people.
So that's,
Okay,
so if we were to stay, I don't have the exact cost, and this would be something more for Chief Fitzgerald, or how are we going to spread it out for the computer aided dispatch program. Some of these I would have to buy the paging program, and I'd probably have to buy the new recording software and things like that to make it compatible, which I would need to add into my budget.
Yeah.
But some of the other upgrades and the services they provide would need to be created here. Like they have a full backup system with power and all the radios. So if they lose their primary, they don't lose any service whatsoever. And it's more than just the generator. It's a duplicate system. So we would probably need to look into something a little more robust than just repowering with a generator. We would need a duplicate system. So there's other things like that that I didn't plan out because I'm not engineering the system. But would like to see go more towards what they have to offer.
Is this something that you would view as a potential attractive element for getting more staff, or not really, doesn't have impact?
I don't think it would impact our hiring for firefighters at all. It could impact firefighter safety. The big thing with us is when we have a Mayday situation
Mhm.
and a firefighter's in trouble, radio communications needs to stop. Dispatch needs to focus on us. We have to rescue a firefighter. That is a very intense situation and event that we hope never to have happen. And we've been training internally on how to do it, but that's a huge thing for dispatch. I know that's something they train all their dispatchers in 4 times a year. And for us, that's a life and death type of situation. So if we stay here, there would need to be much more training along that for the current dispatchers, which is in the plan because I've been working on dispatcher training. But that's just one thing that's a life or death thing that's critical, that dispatcher needs to pay attention to that and can't be answering phones and can't be doing other things on another radio. So if they're by themselves, that wouldn't work well.
Well, lastly, I just want to say thank you very much to you and your crew. Thank
No,
you.
thank
Chief.
you.
Eli, I have a question for Chief Cleary.
Yep, go ahead, John.
Okay, good. Thank you, Chief Cleary. I read your report, which was very, very detailed, provided a lot of information. I'm trying to get up to speed a little bit on this topic, being fairly new to this selectmen, and I know this is a topic that's been discussed for some time. The budget that you have doesn't really deal with any of the dispatching activities. Are they all kind of consolidated under the police budget right now,
Yes,
or
that's all in
what-
Chief Fitzgerald's budget.
that's what I assume. So you
That's
kind
how
of
I can say the cost of the fire department would be
zero.
because
Yeah,
there is currently no cost for us in that respect.
Okay, all right. So I understand. I don't know for this Middleton central group. I don't know how many towns are involved. But did you speak with some of the other chiefs and some of the
Yes,
other
I did.
towns that are using that? And I'm curious what they had to say and how long they've been with them.
Some have been there from the beginning and have related that it was a very rocky start when it first came out, but that things have definitely improved since the state's taken over, since money's been infused, since some of the infrastructure has been updated and upgraded. For the most part, almost exclusively all the fire chiefs I talked to had a positive experience. 1 or 2 glitches or 1 or 2 things done that the dispatch does a little bit differently than they would like it, but understanding that it's part of the whole. And there is an oversight board of area fire chiefs that if there is a concern or something that needs to be done, that you bring your issues to them and they meet as a board along with the directors of the communication center to kind of iron out some of those problems. So there is oversight with both a police board and a fire board if there are any issues that arise.
Okay. Is staffing there somewhat dedicated or partially dedicated to certain communities so that there are people that become familiar with the communities that they probably respond to for calls?
My understanding is they have 3 sections: the people that take the 911 calls, a fire section, and a police section, as well as supervisors on duty. And I think it works on a rotating basis as who gets the call, who's up next, which dispatcher isn't doing anything. If fire dispatcher number 3 is available and a call comes in, it's assigned to them. So they train on all parts of it to be versatile. So I don't believe they commit any one person to any one community.
Or at least in part, yeah, okay, I understand. How many communities are involved in that regional, you know?
I believe 6 on the fire side, if I remember my numbers correctly.
There are 5 total.
5. Okay, thank you, Chief.
Okay, good. All right, thank you. Yep.
other board members, Jeff and Ann?
My major concern is a general concern. And that is the state is doing a lot to get departments involved in this. And it's a long-term concern with the state's commitment to providing funding for programs. Having come out of education and started out when 766 was first implemented back in the early 70s, I'm well aware of what happens with, oh, we'll provide you with all kinds of things, and how that gets withdrawn over time. But I don't think that that's anything that we can bring into this conversation in terms of making this decision. This has been batted around for a long time, and the onboarding cost is remarkably low. So I don't have any specific questions. I appreciate the detail that you provided in both of your memos. And I'll just wait to hear Chief Fitzgerald and go to the general discussion. Thank you very much, Chief Cleary, for all the work you put in on this.
You're welcome.
Ann, any questions for Chief Cleary right now?
No, actually one. The details that you gave, just for my own clarification,
Sure.
would your intention in comparing going with the RCC versus staying here, the amount of money that you'd spend would be to bring town's current fire dispatch up to the level of what's available from RCC? Is that was the,
I would say that would be the mountaintop goal. But I think that that could be very cost prohibitive given the size and the budget. So there would be some things that would be a higher priority for me if I was in charge type of thing as to what we would bring in when, or what would be the most important items. I have my idea about what those would be. But I don't know that you can compare that many employees and that budget to what we would be able to achieve here. I think there are some things that would move us farther than we are here, but I don't know if we could achieve everything that they have to offer.
okay. Without considering the personnel, and I understand your concern with a single dispatcher handling ordinary calls and an emergency. I would like to see a breakdown of you have a shopping list, and I can't tell from the shopping list what's critical and what is nice to have, or would be nice to have later. And assuming that we don't come to a conclusion this evening, is there any chance that you could send around something that lists those costs
Sure.
in priority?
Sure. I think I could probably name a couple of them right off the list. Enough personnel that for the majority of time, if not around the clock, you would be able to have 2 dispatchers working. And the other major thing would be a computer-aided dispatch system that would integrate with our reporting, with any onboard computers that we might purchase in the future, and our paging system.
Okay.
Those would be the big ticket items.
Okay. Let's go to Chief Fitzgerald now. Get a summary from you, and then we'll go around the horn some more.
Yep. Okay, thanks. So reading from my memo that I sent out, I gave you a summary of what it would look like and some costs associated with if we went to the regional system, what the dark station would look like and what it would need. There's some costs there, and my recommendation is that we would have to continue to staff our front window or our front door, even if we did go, and those costs are on page 3. I did a little breakdown of our walk-in reports. We track every single walk-in report, and those walk-in reports can be anything from reporting a crime to firearms licensing, to meeting with me, or request to speak to an officer, or anything, you know, to deal with a restraining order or a harassment prevention order. And I look back 6 years, and our highest year was 2016, when we had 764 walk-in complaints, to the lowest was 2019 of 262 walk-in complaints, and that was coming from our record management system. The highest walk-in rate was on the day shift, which is 8 to 4. The second highest was on the C shift, which is 4 to 12. And, you know, surprisingly enough, in 2018, we had 40 walk-in complaints on the midnight shift. But to say the least, you know, if we went and the station went dark, there's a lot of operational changes that we were gonna have to make. Going to the safe room, you know, if we went, we'd have to construct this safe room, and I outlined that on page 4. Our current dispatch model is we have 3 full-time dispatchers that work a Monday through Friday schedule. And the rest of the time is covered by part-time, either reserve officers who are trained as dispatchers or part-time dispatchers. Back in 2015, MRI did a management study of the police department, and they recommended back then, which is in my report as well, to all full-time dispatchers would be placed on a so-called 4 and 2 schedule, and adding a 4th full-time dispatcher if we were to stay. As far as my shopping list would go, personnel, if we were to stay, and the record management system would need to be upgraded, and that's about $150,000 cost up front. As far as infrastructure and technology, as we're completing the radio system as we speak, looks like it's going to be on schedule to be done in the 1st of February. We already have upgraded our laptops, you know, in our cruisers. We've updated our portable radios. We updated our radios in our cruisers over the past several years as part of our operation. So, you know, so my recommendation again would be the 4 and 2 staff, adding a 4th full-time dispatcher, which would cover most of the days off of the regular full-time dispatchers, and also the rest of the time with paid time off would be covered by our current reserve police officers and dispatchers. But one thing I want to say is, you know, I don't think we've invested in it here. I think we can do it here. Being a resident, I'd hate to lose that personal touch that our dispatchers have. I mean, they have someone that calls up, a so-called frequent flyer, you know, when they know these people and they can connect to these people. And with everything going on today, I feel that's very important. But the main thing I want to stress is before we make any decisions, I think we need the public input from our residents, because I still feel there's a group of people out there that would still want to stay here in-house. It's not to say that regional's not going to work. I mean, it does work for the other communities, but Manchester is very different. And, you know, I just want to make sure that that's vetted before we make any decisions. And the other thing is, how long will regional be free to the town? It's a very attractive offer right now. But then again, like, you know, I want to go back on what Jeff said. How long is that really going to be the case? And we got to look into potential collective bargaining issues here at the police station, because our staff our operations are going to change. We're going to, you know, potentially lose staff, And, you know, a lot of our training is offset by the law enforcement grant, which we receive from the state every year, which is about $60,000. So our expenses would definitely increase here. Our training budget would increase. And we've also used that support and incentive grant to offset some costs of our current radio infrastructure project. So with that, you know, we also need to look into Gloucester. I think Gloucester is a viable option. They are definitely interested in it. However, it's in the infancy stage. I've spoken to Chief Cleary and Chief Smith down there. That's something they will want to talk about, but you know, I don't have any particulars in that. Like I said, it's only in the beginning stages. So with that, I'll take any questions.
Hey, Todd, on Gloucester.
Yep.
I know over the years, different communities have said, hey, we want to put together a regional Danvers, Beverly. We had discussions with Beverly. I think at one point Hamilton was trying to reestablish a regional because they had one with Wenham, and then that fell apart. My experience over the years is the state has told all of those folks to go fish. We have a great regional over in Middleton. Go over there. Is there any?
Well, I think the Beverly thing and we had discussions with Danvers. I think they were too close to the Middleton facility itself. I mean, we're out here on Cape Ann, so that may be something that might get approved. I don't know. Like I said, it's in the infancy stage, and it's very much informal discussion. So before we make any decision, I think we should look into something like that. We would have more control before 4 chiefs, on the board, and we could, vet any type of issues that may arise a lot easier. And again, I'm not saying that the regional's not the place that we need to be. I just want to make sure that we dot all our I's and cross all our T's before we make that decision.
Okay, thanks. Other board members?
Yes,
Go ahead,
I
Becky.
do. Thank you. Hi, Chief. How are you?
Good, how are you?
Well, thank you. I had, and thank you also for your extensive report. Both you and Fire Chief did really very thorough, extensive jobs. I guess one of my questions is, when I read over your summary of the responsibilities of the position you would hire, of those, are any of those responsibilities on your first page ones that Patrice would be able to do?
Then again, that's a possibility, but she's also a union member, and that's something that would have to be addressed through the union and the collective bargaining.
And I guess the current model you have right now, it's a Monday through Friday, is that correct?
That is correct.
And you have, it's a 4 to 12 and 12 to 8. Are those
8 to 4, 4 to 12, and midnight to 8.
Okay, so you have someone on each of those shifts?
Correct.
And is the one that's on the late night shift, is that the reserve officer, or?
That's a full-time employee.
That's a full-time employee. So if an officer's called out or out on a call, you still have someone there?
Yes. Yep.
Okay. What do you estimate the cost of the necessary upgrades to the police department currently? What those would be?
Well, the necessary upgrades would be our adding 1 full-time employee, which I think is about $144,000 a year with benefits, plus a one-time cost of our record management system. I mean, we're using a system that we purchased in 2001, I believe, and that's something that is in dire need of an upgrade.
So other than that, at this point, the police department's in pretty good nick.
Yes, it absolutely is. Yeah.
Okay, and I do, I would agree with you in that we are a pretty wonderful small town, and it's nice to be able to have that, the person on the other end of the line who knows where you live and that, and has an idea of who you are, as well as having the lobby to go to. And I, I agree with asking our town if that's something they would like and if they would be willing to support that financially. My concern though is, with the costs that the fire department would absolutely have to undergo to be able to, keep our firefighters safe. It's pretty extensive. That's just it. That's a concern, but I agree with asking townspeople. Thank you, Chief.
You're welcome.
Other board members? Jeff, John, and Ann. Sounds like Jeff.
Okay,
Go ahead, Ann.
Ann
this is a
first.
really stupid question. What's 4 and 2?
The 4 days on this, so they work 4 days on, similar to our police officers, and they have two days off. So every 6 weeks you get a weekend off.
Thank you. That's what I've
I
got
mean,
for now.
Just one other thing, I looked into other communities that are similar to us, and I look at Georgetown, and similar size to us, similar size police department, similar size with fire department, and they typically run with one dispatcher, but they have 4 full-time dispatchers, and that 4th full-time person would be on a 4 and 2, but on a split. He'd cover the days off of the 4 to 12 person and the midnight to 8 person. So that's where the 4th person would typically, fit in. And our emergency callback procedures that I put in there, that's part of our accreditation process, and something that we have to have, and that's already in place. However, typically here in Manchester over the years, not saying it's not going to happen, it's very rarely used. So to say that we need 2 people on all the time, I just don't see that, given my experience here in town.
Thank you.
Jeff?
Under the current dispatch model, Todd, how often has there been a need to shelter someone when the police station's open and the officers are out patrolling?
I'd have to look back at the calls, but looking back at the numbers that I pulled today, in 2020, we had 326 walk-ins. And like I said, that could be ranging from anything, dropping off paperwork, just coming in to report a crime or an accident. Over my almost 30 years, I can think of probably one time, but that's enough that we have to shelter somebody. I mean, that one time is one person, one time. That's enough.
I would agree that one time would be enough. I'm just trying to get an understanding of how frequently there would need to be someone there to receive someone who is needing shelter.
Well, I don't think it's necessarily to receive someone to receive, for shelter. I think it's, if someone's not here and someone walks in, then you're taking an officer off the street. We only have 2 officers on the street at a
I
time.
understand.
And, we're pulled in so many different directions, from parking enforcement to community policing, which has been tough with COVID. And it doesn't leave much time in a day. So pulling someone off the street all the time, really is not conducive to what we want to do. one of those walk-in complaints can really, if it's a domestic situation, can tie up someone for an 8-hour shift.
Okay, but we're talking about the walk-in complaint that a dispatcher would receive, as
Yeah,
opposed to
right,
a patrol
right.
officer responding in the field.
Yeah, but see, the dispatchers in the building can vet a lot of things that the patrol would not have to typically come off the street and respond to that complaint. With a dark station, what normally happens in other communities is they ring a bell, they're on camera, they talk to regional, and then regional will dispatch someone to the station.
That
So-
typically happens on
Yeah.
on a fixed number of hours, like the midnight shift, right?
Excuse me, Eli, I didn't hear you.
That typically happens on a fixed number of hours, like on the midnight shift, and usually they have during the regular day hours somebody there, right?
Correct. Yep.
The additional FTE that you're talking about at 140K, that includes the benefits package that you're talking about for 22K?
Yeah, I use the 24% factor on my number, and that's typically what I found is good to, estimate the benefits along with the pay.
And the duties of that new FTE would be?
It would be as a dispatcher, a full-time dispatcher, similar to what we have now. We're just adding one more employee.
That's if we remain in the current system.
That's if we remain here. If we don't remain here, then those people would, answer the walk-in complaints, answer the business lines. If regional does not take our business lines, or, wherever we go doesn't take our business lines, and handle the day-to-day operations. I know Patrice is the administrator for, the administrative assistant for both Chief Cleary, and I. And, I have to say that she does a lot here for us, not just for me and the chief, but for all the, men and women that work for us. And her time is very valuable and doesn't, it'd be very difficult for her that would be a change in her total job description, to be doing that and also answering the window and the phones and the walk-ins.
Okay, so you're thinking of having a full-time person during the day at the desk. And that's the new FTE.
If we were to go to regional, yes.
If we go to regional. And then what do you do with the hours that you have with the current person? As I understood it, Chief Cleary gets 2 days and you get 3 days.
Yeah, correct. Yeah, that would remain the same.
So would there be 2 people there during the day, or would you have someone there in the evenings?
Be Patrice here during the day, along with a full-time person, and then there'll be someone in the evenings. Now, we can discuss how that staff doesn't have to be typically 4 to midnight, but our call or our walk-in complaints are typically days 8 to 4 is the highest, and evenings is the number 2.
And can you break that down from 4 to 8 and 8 to midnight?
No, I can't. I'd have to go through every single call the way our records management system is set up.
Time for a new record management system.
That's what I said, yeah.
Okay, you made your argument for that, that's for sure.
Oh, yeah, absolutely. I've been saying that for years.
Other board members?
Yeah, I've got a question. Thanks, Chief Fitzgerald. Also a very detailed report. I'm still trying to get my head around the dispatcher split between the fire department and the police department. The dispatchers from the fire department, are they separate from the police department, or the people do double duty?
No, they do double duty. So our dispatchers dispatch for police, fire, obviously ambulances in the fire station,
Right.
and they also take calls sometimes for the DPW, after hours.
Right,
So,
right.
so they do a variety of things.
Okay, so they're wearing several hats. So there are efficiencies when you've got two departments. I assume most communities are like that. Certainly
Most
of
small
our
communities.
size.
Yeah,
Certainly like that. Are there any that have split where central dispatch for one department and local for another? I wouldn't think that makes sense.
No, not to my knowledge. I mean, before we consolidated here, we were like that. If we got a 911 call, we call on the phone to the fire station and they would dispatch themselves. But that really
That's
didn't work. Yeah.
Right. Okay. All right. A question for Greg. So some numbers have been pushed around here. Greg, have we put together kind of a summary of here are the costs going one way and going the other way, or is that where we're kind of at right now?
That's basically what we're building up to right now.
Okay, all right, I understand that. Well, I'd be interested to kind of see that because we see the numbers on paper here from the two departments, and I'm trying to kind of put them together to say, okay, what's the bottom line here? And I don't know that we've had any input from the public. Becky brought it up, so did Jeff. It's important that we get some comment from the public about what they think about this idea, if that hasn't happened in some way with letters to the editor or something at this point.
It's happened a number of times.
Okay.
And I think we need to be closer to understanding the actual numbers before we ask for major public comment.
Agreed. They have to have the total picture.
I think as well as if regional is offering freebie now, is there any contract for how long it's free or ostensibly free?
When Chief Clary and I met with regional, well, way back when he first came here, they did not have any answer for that. And I think that's either I or him asked that specific question.
Do they offer contracts, do you know, or is it's a year by year?
I want to say it's year by year. I'd have to review their annual report and their onboarding process, again, but maybe the fire chief has more information on that.
Thank you.
So when it was not run by the state, it wasn't year by year. There was a term, I believe. I can't imagine that the state would not do year by year because of the normal state budgeting process. All right.
One more thing, just on that topic, Eli. I understood that once you went with them, there was no going back. So that's not really consistent with the year-by-year contract.
Well, I think, and what they mean by that is it's difficult. Once we lose our PSAP, our public safety answering point, it's very difficult to get that back from the state. So, again, I think we have to explore all avenues and investigate this with the public input before making any final decision.
Thank you.
Okay, so obviously we're not going to sort out all the details about this tonight. I would like to put my 2 cents in on a few different items. So we definitely went through this entire cycle some years ago when it was still run by Middleton. And at the end of that process, we decided we didn't want to make that shift or commitment, in part because, well, in strong part due to lack of maturity of the rec at that time. And it was probably the right decision, given some of the feedback we heard. I definitely think it's worth us taking a look at again. I will say that when we went through that process before, we went through quite a lot of effort to enumerate various different things that we would have to deal with, some of which are in your two reports already. So for example, the vestibule. And we made some very, very rough estimates about how much money it would take to do the vestibule and for the police department, which I think everybody at the time assumed would be a necessary thing. And there were also considerations around updating our communications infrastructure, in particular the copper lines running to the antennas that were problematic would have to be upgraded before we could consider moving to the rec. But some of those things have changed in the intervening years related to the communications infrastructure, and also related to some of our capital plans for the front of the town hall. I think we already have on our list an extension of the town hall stairway over to the police department door, so that you have connectivity between the front of the town hall to the police station. And that actually would address some of the issues with the vestibule that came up regarding handicapped access. So I think it would behoove us to dust off those old plans and lists and assign new numbers to them and flesh them out in terms of the details of roughly how much it would cost and what the impact, what people would actually have to do to if we did move to the rec. And then further establish what kind of time frames it would take us to do to make that move, to make a sort of consolidated report between the fire and the police department on that, and discuss it with the finance committee. And it sounds like, from what the fire chief was saying, and I'd like to clarify this, Chief Cleary, you said in the next 9 months, if we weren't going to the rec, that there were some things that you would be looking to do along the lines of improving the dispatch support that you have. And so presumably those would have financial impact of the town, so they'd be in discussion in this year's budget cycle. Greg, have you and Fire Chief already discussed those? Are those going before Finance Committee, or were already planning on putting those before Finance Committee this year in capital improvements or other improvements?
I did not have those in there for that. So they're not in my operating budget, trying to keep it level funded, and they weren't the primary items in capital, not knowing where this process was going to go. So
okay. So if we decided, if this board were deciding at this point, hey, we're really not interested, then those would be things that you would be looking to add to our existing budget.
potentially, or having to wait another year.
Yeah. Okay.
So could we get a breakdown of those numbers phased in over 2 years?
Sure.
Because
I
just don't want to throw this so deeply into study that we miss the opportunity to bring this forward this year.
Yeah. Some of the items I did put in for a grant for. I won't know for another month whether I have it or not.
Yep.
So that's one potential funding source that could change the numbers, but I can enumerate that accordingly.
Another question that I had was operational in nature. When we last went through this process, and I know the fire department has long been a very strong advocate for moving to a regional dispatch. When we last went through this process and we decided not to go to the rec, there was a compromise position taken where we beefed up some of the actual infrastructure and procedures with respect to dispatch over at the police department. Added a second console and established some procedures by which we'd bring in a second dispatcher if the fire department needed it. And I know that when the university fire occurred, that didn't actually play out the way we had hoped it would. By the time we got that second dispatcher in, things were already too involved, and it didn't play out the way we wanted it to. What I'd like to know is, had there been other cases where that protocol that we established, that support that we established for the fire department actually worked, or whether it was an ineffective solution to the fire department's problems. You may not have that answer available now. I don't necessarily want it now. I just would like to hear some discussion about it, because I know that we made some efforts to address this problem some years ago.
Eli, may I ask a question?
Yeah, go ahead, Becky.
Do you have to, if you can fire go to the RCC and not police, or do you have to do the whole thing?
No, you really have to do the whole thing.
Both agencies have to go.
Coordinate those two. It's a mess.
Okay,
If you have a fire, it's almost always the case that the police go to. And if you have two different, completely independent communication systems dispatching between those, it's a train wreck.
mm-hmm. Oh, well.
So Eli, what's the time frame that we're going to try and do this in?
Well, Greg, you got some feedback here?
Well, I think the two chiefs and I can sit down and map out the framework of this consolidated report and see what data is missing. My sense is we have most of the data. So I don't think it's too heavy of a lift to pull together a consolidated report. So I'm not going to say in 2 weeks' time, but by the middle of February, I think that's reasonable.
How does that work, Greg, with the meetings between the chiefs as department heads with FinCom?
So those meetings will occur before that time. So they're scheduled to be before FinCom later this week for fire, and then the chief is next week for police.
Maybe I'll put this a different way. So let's suppose that we put together these reports and we meet in February, March, whatever, and we have some discussions around them, and we decide, we really want to push hard and investigate this further. It seems.
Hey, Eli, can I just make one comment?
Sure.
Going back to what you asked in regards to the emergency callback procedures, I'm not aware of the incident that happened on University Lane of that not working, because I was one of the responding people here to the station to assist with the dispatching procedures until someone else came in. Typically, I'm the one that responds because I'm the closest one. If obviously if I'm in town, but I can try and find the information that you're looking for. But I just want to make that comment about the University Lane one. I was unaware of that, and I'm not sure that actually was the case.
Sure. If I'm misreported that or misrepresented that in any way, that's my bad. What I was going by was my recollections from the reporting from the interim chief at the time. And I'd have to go back and look at the report for the details, but it was my understanding that there was some issues with not being able to communicate with District 5, and that there was a delay in getting that second dispatcher in. But if you're saying that there was coverage regardless, while that second dispatcher was not in, I'll certainly take your word for it.
Yeah, I think there was a lot of communication problems with the radio infrastructure itself. I think that's what the problem was, and I think that's being addressed now as we speak.
All right. Going back to what I was saying regarding your comments, Jeff. So if we decided in February, March that yes, we really, really wanted to look in more depth at this, I think there's a presumption on our part that we wouldn't be assuming that we would be committing in this budget cycle to all the capital aspects that would be required, or actually effectuating the changes in this fiscal year. But would there be budgetary items that would come in order for us to be able to begin the process or fully research the process? And check me if I'm wrong on that. Is there, what's the board's temperature? Does the board think that we actually, if we could move forward and make a decision on this in this fiscal year? I don't see how we could actually reasonably do that, and do the public outreach that would obviously be required. But correct me if you think I'm wrong. Correct me and tell me if you think we should push that hard. We can always try.
If I may.
Yes, please.
Even if we wanted to, could we actually get the changes necessary in the police station to make it safe or find some other way to make it safe to have a dark station from time to time? Could we get the physically done in time that we could actually join the region in this fiscal year, in this coming fiscal year?
So I think, as the chiefs indicated, it's a 9 to 12 month process. So you're not flicking that switch for another year. So can you do that vestibule upgrade in a year's time? If we have the money, yes. So that's probably one of the bigger cost items that we're facing if you want to proceed.
So if we can't possibly flick the switch for 12 months, then what does the fire chief need in this budget?
So if you're switching, you ideally would put money in the budget to effectuate the switch, which focuses on the vestibule as a capital issue and how you want to handle the dark station challenge. If you're not switching, if you're staying with the status quo, then the fire can probably limp along for another year. It's not their ideal, but they could probably limp along and have the status quo, and we can look at doing some of those internal upgrades in 23. You could, if you know by March that you're staying with the status quo, you could think about doing some adjusting to the current proposed capital to do at least, they both indicated the record management as a top priority. So maybe we do some juggling of the capital, and you've decided to stay in-house, so we focus on getting that records management system in the 22 budget. So in my mind, those are sort of the two different pathways and the two main items that would sort of come to the fore in the revised 22 budget, if you were so inclined to move a little quicker.
The vestibule improvement would have the additional effect of making the police station handicap accessible when the town hall is not. Is that true?
No, town hall is accessible.
Town hall is accessible, but town hall at night when the town hall is closed, how do you get to the police?
Right, you need that bridge, literally, from
Okay.
from the town hall landing to the police landing.
So if it's
In my
Friday,
mind, that's part of the vestibule cost in essence.
if it's Friday and a handicapped person wants to talk to the police, what do they do?
you go downstairs to the handicapped entrance. And I believe there's a camera there that the police can see. Is that correct, Todd?
Yeah, they go downstairs to the handicap entrance and come up on the elevator, and then we let them in through the front conference area.
And they know that how?
Yeah, they don't. That's the thing. It's very difficult. Yeah.
Could we maybe get some signs? So that just in case ever somebody handicapped has a problem on Friday?
Yeah, that's easy to do. That's something we'd have to talk to Nate from the DPW, but yeah, that's definitely something that should be addressed.
Should have been. Thank you.
All right, so getting back to schedule and inclinations. So I think putting together the that consolidated report in the near term is a good thing. If we are going to discuss actual capital items on the budget, that presumes that we would need to have some public forums before we got to town meeting and presented them with a potential capital item, which would be related to an item that people are going to have mixed feelings about. So if we did that, then we would be committing ourselves to need to have public forums on this particular topic, in the March, April timeframe.
I'm not sure what you're referring to. Are you referring to extending the landing in front of the town hall entrance to the police entrance as something that is based on whether we go to dispatch or not?
No, actually, you got a point. I made an assumption that if we were considering doing a vestibule there, or needed to do a vestibule there if we were moving to a regional dispatch, that it would be best for us to incorporate that into a project which extended the front of town hall. But like I said, that's an assumption. I don't know if that's true. Maybe those two things could be done reasonably in two phases and it wouldn't incur any additional cost to the town.
The other option that I'll throw out to you is not try to make these decisions for this coming annual town meeting. And that if decisions are made, say, over the summer, and we have a fall town meeting, I'm assuming we will be back to that by the fall, that you could bring one or the other options forward at that time and have a supplemental expenditure to do whatever path you've decided.
Just to throw one other parameter into all of this, we're operating on a timeline of an April town meeting, first week in April.
Well,
And the likelihood of that happening,
It's pretty rare.
given the vaccine rollout,
Right.
is pretty low. And that we may very likely be looking at a town meeting end of May, beginning of June, as we did last year. In which case we have a little bit more planning time for this year to produce a warrant in advance of the town meeting. I'm just concerned. You want to know the temperature of this board member? I'm just concerned that this decision has come up and gone down and come up and gone down and come up and gone down a number of times. And I'm not trying to just say, let's get it done, but I am saying, let's get it done. In the sense that let's make the decision that we're going to go in this year or next year. And I would suggest that it's not a consolidated report, but I'd like to see two consolidated reports from the two chiefs together with numbers, focused on the numbers that say this is what will happen if we go this year, and this is what will happen if we postpone for 1 year and go next year. But I think in the long run, this is in the cards, and we need to make that decision so that we can plan. That's all I have to say for now.
Other board members?
Eli, may I ask a question?
Yep.
If you go to, not you, but we as the town, go to the regional communications center, is it possible to still have an after hours, somebody at the station decides an on-duty police officer to man the vestibule? So that we don't have a dark station.
In the midnight? You mean?
Yes. Yep.
Obviously, the answer is yes. It's just a matter of,
Okay.
pay.
Well, I agree with Jeff. I also think that Todd is right. I think we need to make sure we check with the townspeople.
And Eli, if I may, to that end, I'll amend Jeff's comments by saying we need a third report. And that is if we stay in town as we are. So you've got, if we do it, we do it this year. If we change and we change next year, or C, we don't change at all. So you got 3 scenarios.
Yep.
And that's what the public has to look at, and we have to look at.
Oh. Yeah, we actually did do some of those as well when we last looked at this several years ago. And there's argument about what was actually required and what was not. And I expect echoes of that to resurface. Yes, Chief Clear, go ahead.
Thank you. I just want to state from my point of view, I realize we're talking dollars and cents for changes for staying and going. I approached this whole thing coming in new as looking at it operationally. I'm looking at what it would take to have enough dispatchers so proper attention could be paid to the police officers on the street as well as the firefighters, and that the dispatch software, if there are limited numbers of dispatchers, would make their job easier and have screens that would populate all the information that they need to give to us on a call, like a cross street, like the nearest fire hydrant, like any hazards in the building. And currently right now, they have to go to 2 or 3 different screens on 2 different computers, as well as 3-ring binders to put all that information together. And when we have an incident go, it can go pretty fast. And that puts them at an extreme disadvantage in having to go to several different sources to get the information that the program would do. So I know things that I would ask for to help us be more efficient would in turn cost Chief Fitzgerald more money in his budget. I get that, but I'm still looking for the safety of the police officers and the safety of the firefighters based on the job the dispatchers have to do.
So when we added in or when John discussed the notion of 3 reports, what that really turns into is 4 reports. 2 from each of the chiefs for the 2 different cases. And I question whether or not this gets a little bit noisy. I can see the 2 different directions. Why is there a strong preference for having it split into 2 reports as opposed to consolidating it into a single unified write-up as Greg suggested?
I think it's one report with different chapters,
Yeah.
is what I would suggest.
Personally, I would like to have the numbers in coordination between police and fire for the decisions that we're talking about making. If we're going to go this year, if we're going to go next year, if we're not going to go, and we're going to have to fund this over the next 10 years in-house. I think we really need to look at the costs that we're looking at to assure the safety of our public safety officers and our town. And the format for the report, whether it's one thing with this is police, this is fire, I'd like to see police and fire saying, this is what we need for dispatch services. This is what we need for dispatch services together. For this year, for next year's implementation, or for never implementing this. And make a decision so that we can move forward. And that the decisions about the changes and coverage at the police department, if we do go forward with the safety door, I think those decisions should be, the safety door maybe not, but the decision about the change for the vestibule, that needs to happen independent of this, and it has to happen this year. Because of what Ann's saying. We don't have a handicap access.
All right, Greg, under what time frame do you think it would be reasonable for you to produce such a document?
No, I think we target your second meeting in February. I don't see the chiefs throwing tomatoes at me by saying that, so I'm assuming that's okay. I'm going to be drawing on them heavily to help with this, obviously. It's the other way around. They're doing it. I may offer a little bit of help. So, but I think that's a good goal.
I think that's reasonable too, Greg.
Yeah, that should work.
Right. Happy with that, Jeff?
February 15th.
Yes.
That works. I mean, yeah. I think by then we'll have decided what we're doing by town meeting as well.
Well, who knows? I think if you were to ask Alan, well, let's not speculate.
If you ask Alan, he'd say do it in July.
June 37th.
June 37th, yeah.
All right. Anything more that we want to go on this topic tonight? Any more comments from board members?
I want to thank the 2 chiefs for the information that they provided tonight. I think that what we're talking about is just, putting information together, financial information together in a consolidated way that we can make a clear decision on.
Mm-hmm.
So, but thank you for all the work that you did to prepare the reports for tonight. That's a lot of the data that you're going to need to work off of. So,
You're welcome.
Thank you.
Yes, thank you.
Yes.
All right. Well, thanks, chiefs. And ordinarily, with this kind of a topic, we'd be going to motion to adjourn, but no, we're not. Moving on to the next. So, on the consent agenda, we have the Board of Selectmen meeting minutes from December 21st and January 4th, and the approval of the housing production plan, which was approved unanimously by the planning board at a previous meeting. We are taking out the ratification for town clerk. We still have a little bit more I's to dot and T's to cross there. So just the minutes from the 21st, December 21st, January 4th, and the approval of the housing production plan. Any questions or comments from the board? Can I get a motion to approve the consent
Wait,
agenda?
I have at least a comment on the housing production plan.
Yep.
Which is, if we need a housing production plan, I guess this is a housing production plan. If we need a plan for producing housing, it doesn't reflect the town as I understand it. I will vote to approve it, but I would like to see something about half the length with about 100% more focus on what can be done in Manchester, given our topography and our transportation centers. That's a useless comment, but I had to make it.
No, I wouldn't say it's a useless comment.
Yeah, I wouldn't either.
So move to approve the housing production plan as presented. Oh,
And the
the consent agenda altogether, with the exception of the town clerk.
Second.
Greg, is in the cards to get a, over the coming months to perhaps get a summary report out of the housing production plan that focuses on elements that are practical for the town in the near term.
Yeah, I mean, I think what I heard Ann say was that we need a realistic, specific action plan, not sort of a laundry list of possibilities. But
And impossibilities.
Right. So something more concrete and specific and doable in the next couple of years. That's what I took away from that. And yes, we can try to work with the planning board and others to come up with that.
Thank you.
Any further discussion? All in favor of the consent agenda, roll call vote, Mr. Round,
Yes.
Ms. Harrison,
Yes.
Mr. Bob Turner,
Yes.
Ms. Jakes,
Yes.
Mr. Bowling votes yes. Correspondence, we have a letter from LEC Environmental Consultants regarding the Tobacco Road Infrastructure Improvements Project. That relates to some effort by Hamilton to move some parts of Tobacco Road around a little bit and pave it over the existing gravel portion, but that is a long-term project. They're going to have to jump through a lot of hoops before they can actually do that. This letter just gives us some notification that they are beginning that process. Who knows if it'll actually happen. Town administrator's report.
It can be fairly brief here. Some disappointing news on the compost facility and the response to our RFP. We're still evaluating some recommendations for sort of the fallback next steps. DPW and I hope to have that ready for you at your next meeting. But did want to give you the heads up that we do not feel we had responses to the RFP, and we're going back to the drawing board a bit on that project. So stay tuned. We'll have more information at your next meeting about perhaps some next steps that we can take. Number two there on the 111F case, some initial conversations and doing some follow-up, and hope to have some more information for you at your next meeting. The 40R work, there's a couple meetings last week, lots of questions, a lot of pluses and minuses that people are seeing. I think that we would be wise to look at some alternative options, to changes to the LCD, to perhaps other approaches that don't have quite the same requirements for housing that the state 40R program has. So planning board will be taking a look at the at different options. They'll be evaluating the feedback that they've received during last week's meetings, and we'll be coming back to you with some recommendations. But I think it certainly makes sense to make sure we have different options out there and not putting all of our hopes into one approach. I think we may need alternative approaches. So with that, I can wrap up and call it a night.
Okay, I have no other matters as may not have been reasonably anticipated by the chair. I always love reading that without tripping over it. And, well, we do have another matter. Jeff.
I just have a question about what Greg wrote in his notes regarding the 40R. What's the time frame for the all boards meeting?
Don't have a specific date yet. We'd like to do that in the latter part of February.
Okay. Thank you.
Now I'll take a motion to adjourn.
So moved.
Second.
Any discussion? Roll call vote. Mr. Round.
Yes.
Ms. Harrison.
Yes.
Mr. Bob Turner.
Yes.
Ms. Jakes.
Yes, sir.
Mr. Bowling votes yes. Good night, folks. Thanks for another fun-filled evening.
Good night, everybody.
Thank you.
Good night.
Night.